Hi, welcome to another fantastic episode of You Didn't Get the Memo show. I'm your host, Gloria Bailey Reagan. As always, guys, I strive to bring you relevant, factual, mainstream information to help you be informed and to make informed decisions. And today is no different from any other except for, listen, we're going to enlighten you, educate you, and give you some information that's going to help you be prepared to deal with a situation if you find yourself tested positive for COVID. But before we do that, let me just welcome everybody to the show. And I want all of you that are new to watching the show to understand that we really and truly are about providing you, the viewer, with relevant, factual, and mainstream information to help you be informed and to make informed decisions. Also, I want to remind you, those of you that are new, you can actually ask questions of the guest. You can place it in the comment section, and we will do our very best to get to them. Now, for those of you, thank you so much that shared with me that you weren't able to leave comments on YouTube. So it looks like that has been remedied, and you will be able to leave your comments on YouTube as well as on Facebook. Hey, today my guest is Miss Key Conti. She's the director of Total Infusion Center. That's right here in Oakland, but you guys know we're all over the world. So check this out. I truly want you to stay for the full 55 minutes because the information that you're going to get here, it can possibly save your life or someone that you love, and definitely prevent you from ending up in a hospitalized situation. Notice I said possibly. But listen, there's a lot of misinformation that's out there floating around about the coronavirus. Now there's the Delta variant. Here's my question. Did you know that unvaccinated people who have had COVID-19, that you may be more than twice as likely to get infected again than those who tested positive and they bolstered their natural immunity with the vaccine? The CDC, of course, talks a lot about vaccines reducing the risk of infection, but I just want you to put that to the side for a moment because what we want to talk about is what happens if you test positive for COVID and you're in a 10-day window. So I'm going to bring in my guest, Miss Key Conti. Welcome her to the show. Key, welcome. Thank you so much for joining me. I'm excited to have you. And I'm going to jump right in and just say, look, let's just start with, first of all, telling viewers a little bit about your background, where you grew up, what inspired you to become a nurse, and then what's your why. So I asked all those three questions, and I'm going to let you take it away. But let's go from there.
Absolutely. Thank you so much, Gloria, for inviting me and giving me this opportunity. Hello, viewers out there. Thank you for joining us. I grew up in Cleveland, Ohio. My name is Key Conti. I grew up in a neighborhood that's much like East Oakland, where we operationalized Total Infusion. When I was in fifth grade, I wanted to be a school teacher, actually. And my fifth grade teacher sent me to take a test that was being administered to all of the students in Cleveland Public Schools. She sent me to take this test, and I outscored most of the children in the city and ended up attending the School of Science. And that's where my love for science began. I still thought that I wanted to be a school teacher, but I was actually very ill when I was a young adult. And there were nurses. I was far away from home in Savannah, Georgia. There were nurses that nursed me back to health. I was in the hospital for 30 days. And during that time period, I spent so much time with those nurses, and I had such great respect for the way that they cared for me and nursed me back to health medically and emotionally, that I left the hospital wanting to be a nurse so that I could have that impact on someone's life as well. And it's 30 years later, and here I am. I pretty much spent most of my time working in oncology, hematology, and infusion. About 10 years in, I had the big head and thought that I knew everything about oncology nursing and went to work in the emergency department. And they used to tease me in the emergency department. They would say, Key, you talk too much to these patients. We want you to treat them and street them. And that's when I knew that I needed to go back to oncology because I needed more than that, and I needed to give more than that. So I returned to oncology, and I've been there ever since, spending most of my time working in ambulatory infusion centers, much like the one we opened here. Gloria, you asked, why do I do this? Working in ambulatory infusion centers, I started to notice things like I didn't see people of color as much. And when I did see them, they were further along in their disease process. So I started understanding that something was wrong there. So why am I here now? Basically, to address one of those barriers to care, and that's the geographical barrier to care. So we operationalize total infusion right here in East Oakland.
Okay, awesome. I always love to hear what the backstory is, but your why. So we have a number of things in common. You're the director of Total Infusion Center. Can you tell our viewers what type of work is being done there? And I want those that are tuning in, listen, we just want to level set what's going on before I get key into talking about this life-saving therapy. So going back to what type of work key is actually done at Total Infusion Center.
Absolutely. Total Infusion is an ambulatory infusion center. And what that means is patients come into the infusion center. We start an IV and we administer medication to them through their vein. So it's much like if you were going in to receive chemotherapy. This is for patients who are ambulatory, meaning that they can walk around. This is a way to have them come to treatment, get their drug, and then go on about their life, go back to work, go back to home, go back to whatever they were doing. We administer all types of drugs here. We administer iron, IV iron replacement. We administer monoclonal antibodies. We administer antibiotics. We hydrate patients. Many of you may not know, but if you are dehydrated and you go to the emergency department, you are probably looking at a $7,000 bill. If you come to a community-based ambulatory infusion center, we can hydrate a patient and have them home in a couple of hours under $500.
Okay. And I think that that's really important. People need to know that infusion centers are all around them, but it's not explained what do they do, what is it about. And so instead of you going into a hospital and running up, thousands of dollars, you can go and, like you said, you know what, you can treat them and street them and they're in and out. So that's the thing. But today, Key, why I wanted to have you on the show is to talk about something that's really that has impacted my life with one of my family members, and it was just so. I always say the blessing is you meeting and knowing people and finding out and doing research, and the research. And what we're finding is there's information that so many people of color don't even know about. They're not even aware. And I can say this even from the standpoint of my family members. Had I not had access to this information to share with them, there, even some of the major teaching institutions had no idea what it was or what it was about. So we're going to just jump right in, and I'm going to ask you to, first of all, tell the viewers what is a monoclonal antibody and how does it work, and then we'll get into how and where we can take this. So I'm revving up for it, but let's just
Okay.
start with telling the viewers what a monoclonal antibody is.
Absolutely. Basically, a monoclonal antibody is a protein that's made in the lab that mimics the human immune system. That's what it is. And the way that it operates for COVID, for example, you've all seen that cell with the spike proteins. Basically, the monoclonal antibody binds to those spike proteins and neutralizes that virus, prevents that virus from continuing to make more virus in your body and get into your cells. So basically, that is what a monoclonal antibody is, and that's what it does for COVID. There's all types of monoclonal antibodies, but we're going to focus on this particular monoclonal antibody for COVID treatment.
Right, absolutely. So, um, why this is important? Because some people have tested positive for COVID,
Mhm,
and all people hear is, "Oh my God, I got COVID," and
mhm,
it's like they go home and crawl up in a ball and die, and that really is not the case. And what we want to do is to educate. Our viewers to understand what this treatment is. And the treatment we're talking about is the monoclonal antibody that
mhm,
you can get and in this case, at Total Infusion, but
mhm,
infusion centers that are all around. I mean, it's
mhm.
thousands of them all
Yeah.
around the United States. But what's interesting, Key, is it's not really being talked about. You hear a little bit
Mhm,
here, a little bit there, but
mhm,
we want clinicians to know you have an obligation to share this information with your
mhm,
patient. Don't
mhm,
just send them home and
mhm,
tell them to get some rest. So
mhm,
I want to just, have you talk about, what happens when someone who has tested positive for COVID
mhm.
shows up, they've been referred to your infusion center. Kind of walk us through what
Mhm.
they can expect.
Absolutely. So I'd like to back up just a little bit to talk about who is eligible to receive the monoclonal antibody.
Yeah,
Do we have
absolutely.
for that, Gloria? Okay, great. So if you've tested positive for COVID and your onset of symptoms have been within the last 10 days and you have a high risk condition, then you are eligible for this treatment. That list of high risk conditions is long. The physician has a lot of clinical latitude to decide if you are at high risk. But if you have heart disease, lung disease, diabetes, obesity, sickle cell, chronic renal disease, any type of immunosuppression, if you're on any type of medication that causes your immune system not to function robustly, you qualify. Even race and ethnicity was added to this list in May. So if you meet that criteria, you must demand that your doctor have a conversation with you about the treatment and refer you. If you're here in East Oakland or in our area, we welcome you here. If not, as Gloria said, there is a map that you can go on and you can type in your zip code and it will tell you where to go. Now, once you arrive in the state of California, at least, due to the high percentage of the Delta variant, there is only one drug that is currently being shipped to infusion centers that is recommended. That is casirivimab and imdevimab. It is co-formulated and its brand name is called Region Cove. So it's 600 milligrams of each of those monoclonal antibodies that I just mentioned. We basically give you a fact sheet when you arrive so that you will have all of the information about the drug. We answer all of your questions, you consent to treatment, and then at that point, we take your vital signs. Your vital signs are stable. We start an IV and we run the infusion. The infusion lasts for 50 minutes to an hour. And after that, we take your vital signs again, and then we keep you for an additional hour to make sure that you are stable. If you're going to have an adverse reaction, you are likely to have that reaction during the infusion or during that post administration period. I can tell you that patients have been tolerating the drug very well. Across the country, we've only seen less than 0.5% of adverse reactions to the drug. I tend to call back patients and see how they're doing. Most of them will tell you that they've had a decrease in their symptoms, but it's very important to get the drug as soon as you are diagnosed. Yes, you have a 10-day window, but please don't wait on that 10-day window, because while you're waiting, that virus is basically hijacking your good, healthy cells, and it gets a head start on the monoclonal antibody. So you want to get the treatment as soon as possible.
Mhm. Okay. And thank all of you guys. If people are tuning in, we've got people all around, and thank you guys so much for tuning in. If you have questions about the monoclonal antibody that you're hearing my guests talk about, put them in the comment section. In the meantime, what we're going to do, always got to pay a few bills. So, the key, if you will hang in there, when we come back, I want us to talk and kind of delve deeper into, maybe why some physicians aren't talking about this life-saving treatment. What's going on out there? I'm like, hey, this is vital. It is vital. But we're going to talk about that when we come back. So you guys don't go anywhere. Hang in there. Thank you so much for tuning in. We'll be right back.
If doctors, nurses, and grocery store clerks can wear a mask for 10 or 12-hour shifts, you can wear a mask for an hour or less when you go to the store. Do your part. Mask up, America.
Show some respect. Show you give a damn. Show the world how it's done. Show them that when your community needed you the most, you showed up. Mask up, America.
All right. If you guys are just tuning in, you are tuned in to You Didn't Get the Memo show. I'm your host, Gloria Bailey Ray, with my dynamic guest, Ms. Key Conti, who is the director of the Total Infusion Center right here in Oakland. But you know what? While we were at commercial break, we had a couple of questions and comments. So let's just start with a comment is recently had the infusion, had no issues. So I'm like, that's awesome. But she also has a question. Can you receive the infusion more than once if you get the virus again? And that's a good question.
Mm-hmm. So currently, the infusion is recommended to be administered once. However, the FDA is making a lot of changes. Initially, the infusion was only for those that were COVID positive. I believe it was July 31st, the FDA said that they are now going to allow the infusion for post-exposure prophylaxis. And basically what that means is that if you are at high risk, and let's say your husband comes down with COVID and you are someone who is a cancer patient and on chemotherapy, we already know that you will not mount a robust response, that your immune system just cannot fight that virus. So even before you are diagnosed with COVID, you are allowed now to have the infusion. There's also some discussion going on, and this is still evolving, but there's discussion going on about even allowing individuals to have the infusion monthly if they are in a constant state of risk. So they are talking about individuals that are in nursing homes, prisons, possibly even healthcare workers. But again, that information is still evolving, so I don't have all of the details about that just yet.
Yeah, well, that makes sense. But the thing is to continue to elevate our knowledge base around, something that's out there, because all you hear is people get COVID and then it's like they just kind of fall apart. So hearing that, but before we went to break, one of the things that I said I wanted to dialogue a little bit about was, physicians, there are a lot of physicians out there, and I know it's all across, but they're not talking about this. And
Mhm.
so what do you think, or what may be attributed to the fact that they're not telling their patients about it? Or I mean, do they think they're going to lose their patients if they go to an infusion center? I don't
Mhm.
know. And so I'm just curious, what are your thoughts as it relates to why the information isn't out there like it should be?
Well, that is a complicated question, and I have a lot of thoughts about it. I can tell you that when we were working to operationalize total infusion, we actually were not planning to administer this monoclonal antibody. We were actually just working on our standard of care infusion therapy services. And essentially, what happened is I started talking to some of the people in the community that had COVID, and they were sharing that they had no place to receive the drug. So I told them, no, you can go on Combat COVID and you can go to the infusion center locator and you can find a place. And they said, well, Key, we can go on there, but we still can't find a place. So I actually started looking myself and started making calls and started making referrals. And I thought, wow, I can't get an appointment. So I know exactly what they mean. So at that point, I called up the Department of Health and Human Services and I said, we have the drug in our area. However, it's not accessible. May we have the drug here? And they said yes. They did their investigation. They sent the drug to us. And I was really perplexed initially when I was reaching out to physicians, to organizations saying, we have the drug. I can see that the COVID cases are going up every day. Where are the referrals? Because I knew that they weren't being treated in the community. And the response, it was very quiet. We had the drug in our medication refrigerator for weeks before we saw the first patient. Then we started getting referrals from Roots Community Health Center, La Clinica, the Watness Wellness Center, but that was it. There were no referrals. And what I believe is that I think there's a few things. Number one, I think there was concern that COVID treatment would step on the message of vaccination. And I just want to be clear here, get vaccinated. However, we all know, at least in East Oakland, that we have the lowest vaccination rates and one of the highest 28-day case rates. So while we are promoting vaccination, there are people that are not vaccinated. And if they come down with COVID, we want to treat them. The second issue that I believe is that I think it's an issue with infusion therapy access. Having managed and directed infusion therapy centers for all the years that I did, we know that cancer patients that need chemotherapy can wait 30 days before they start treatment. Patients with chronic autoimmune disease conditions can wait 60 days, 90 days before they start treatment. I remember when all of the patients came inpatient to receive chemotherapy, and I was here for the paradigm shift from inpatient to outpatient. I remember when the room was full of only cancer chemotherapy patients. Now, you may not be aware that multiple sclerosis, rheumatoid arthritis, lupus, inflammatory bowel disease, these patients are now outpacing cancer chemotherapy demand. So I am certain that large organizations really struggled with, how do we do this? I know that I'm receiving calls now from other organizations that tell me they just don't have the capacity. Stanford Valley Care was one of the outpatient centers that was administering the drug. I just heard from them this week. They can't do it. They're sending patients now from Pleasanton to Palo Alto. So now they've asked us if we can help. So I believe it's a little bit of, oh, and I have to talk about the fact that there is also a knowledge deficit.
Yeah.
I do have physicians calling every day asking about the drug.
Mhm.
Some think that it costs a small fortune, so they won't refer their patients because they just assume that they cannot afford it.
Mhm.
That is a myth. And others, I don't know. I don't know if they question the science. I'll be listening in, Gloria, if you have guests that are
Mhm.
physicians or if you can hear directly from them. But I think there's many factors here.
Yeah, I agree with you. But one of the things, it is my hope by us doing the show today is that a lot of the clinicians will actually stop and say, hey, I need to get informed. I need to understand how this drug actually works. I need to know. And that myth about, oh, it's going to cost you thousands and thousands of dollars, and the drug is free. It's so for me, I just think that the more we know, the more that we're informed, the better off we are. The Bible tells us that our people perish, because of lack of knowledge. And even though it's all these things out there, we really need to go to the source. In fact, one of the things I like to do, Key, is to play a video from Dr. Reed Tuckson, and let's hear what he has to say about that. Okay? Let's see here.
People continues, we must also have treatments that are readily available to help those who become infected avoid the worst effects of COVID-19. And as communities of color continue to be disproportionately impacted by COVID-19, I want to talk to you about an important opportunity, and that's enhancing access to monoclonal antibodies. This therapeutic has been given an A rating by the National Institutes of Health Treatment Guidelines Panel based on the strength of the evidence in reducing the risk of progression to severe disease and hospitalization for high-risk COVID-19 patients. In May of 2021, the Food and Drug Administration expanded eligibility for this treatment and gave providers much greater latitude to exercise their clinical judgment in their use. In fact, this is what they said. Any medical condition or other factor, including race or ethnicity, that puts a patient at higher risk for progressing to severe COVID-19 can now make them eligible for monoclonal antibody treatment. I urge all clinicians to take this opportunity to improve outcomes for all of your high-risk patients and to address the higher rates of COVID-19 hospitalization and death for communities of color. Urge your patients to get vaccinated, and for those who do get sick with COVID-19, identify who is at risk and refer and connect them to monoclonal antibody treatment as soon as symptoms develop. Treatment of COVID-19 patients must begin as soon as possible and at least within 10 days of symptom onset. The treatment is widely available and cost will not be a barrier in many cases. To learn more, please go to combatcovid.hhs.gov. Once again, go to combatcovid.hhs.gov. Thanks for listening.
Yeah, okay. So, Keith, we heard it from the expert, right? And again, we just got to push this. And so everybody that's viewing this, I really and truly hope that they will push the envelope. So we got a couple of questions from the viewers. Here's one, Key. How do Lauren, thank you, Lauren, wants to know, how does she advocate for this treatment with her PCP?
Absolutely. So I have not had one patient yet give me any type of scientific reason as to why they cannot have the drug. And that is what you must demand from your physician. Now tell me why you will not give me an order for this drug, and then you go someplace else that will order it, because it's not right to simply withhold the medication. There are no medical contraindications to receiving this treatment. The only reason why you cannot receive this treatment is if you have had an anaphylactic reaction to this treatment in the past, then we will not give it again. But other than that, we have seen pregnant women, we have seen children that are older than 12 years old. You give the information to your doctor. I think that Gloria is going to share a flyer with the viewers There is a flyer from HHS, that's the United States Department of Health and Human Services, that tells the provider exactly what the criteria is. And if you need to, you circle the criteria and how you meet it yourself.
Absolutely. And in fact, let's see, here's the flyer right here in terms of early action being vital. And from there, you've got to learn about treatments, what's available, what's out there. It's our responsibility. I think that that's really important. One of the things key that I found out is that a lot of people who are not of the Black and brown persuasion are coming to your clinic. They found out about it, and people are coming from far and wide. So the areas that you all live in demand it. It's your right. It's your constitutional right that you are supposed to have what is going to benefit you and to keep you and your loved ones from progressing to a state of, even worse, I would say, that downward spiral. So I think that that's really, really important, and here's the thing. We talked about the referral and what somebody needs to do to advocate, but there's such a sense of urgency. COVID cases are on the rise, and you guys, we've got to do a better job in getting it out here. And I just think that, the risk of not getting the treatment, I can't even imagine. And I don't know what your thoughts are, Key, about that, but, for a 55-minute infusion, one time, you're in and out. Why wouldn't someone want to get this life-saving treatment? Why?
Gloria, one of the things that we're encountering daily also is patients will call and they'll say, I received my test results. I tested positive for COVID. I can't get in touch with my doctor. Now, like I've said, like you've heard Dr. Tuxson say, you can't exactly wait a week to get in touch with your doctor.
Yes.
We've had a lot of patients. They'll try to call their doctor. I'll start hearing from them first thing in the morning. By the end of the day, they'll tell me, I'm going to the urgent care. And we have a lot of patients that have gone to One Medical, actually, and told them what's going on, showed them their COVID results, and they have sent an order, and they're in my chair the next day.
Okay.
So you really have to advocate for yourself. I have another patient whose doctor was out of town until the 18th, and he was told, well, the doctor will call you back when he gets back in town. No, you don't have time for that.
Right.
So that patient also went to an urgent care doctor gave him an order. So you must be empowered to advocate for yourself.
Yeah.
And some of the physicians, keep in mind also that depending on where you're getting your testing done, that information may not even make it back to your primary care physician. So you have to make the calls. Like if you go to Walgreens, there may not be any bells and whistles going off in your doctor's office that says that you tested positive for COVID. So you have to call them and tell them, I tested positive for COVID. And you get online and you find your infusion center so that you can tell your doctor, I tested positive for COVID. Here's where the infusion center is. Send my order, please.
Yeah, I agree with you. One of the things that I've often said, and my family members know it, I'm like, if I have to go postal, then that's what's going to happen, because you can't give me back my loved one, especially knowing that there was treatment available. And I want to really, really underscore the fact that you said, let's just say, for instance, you get a COVID test on Monday, and the results are back on Tuesday, although it shouldn't take that long, but let's just say on a Tuesday, you have 10 days. And remember, infusion centers are not open on the weekends. So you've missed your 10-day window. So that's why it is vitally important that you really push the envelope. You demand that you get that referral and you get in ASAP. You want to get this taken care of. So I think that this is just critical. Let's just take a look at some of the comments. Thank you, Beauty Box. Excellent information. Miss Cassandra, thanks for sharing. Miss Georgia, thank you so much for getting the information out. Miss Deborah, already sharing. I love that. Thank you.
All
I love
right.
you so much. Um, Thank you for the information. And then we have a comment from Ms. Kim. Classic reasons we have such issues with health disparity. Amen and amen to that. And you know what? I just want all of you guys to know, don't even think about the fact that when you go in, now I'm from the South. So one of the things that you just kind of go along, yes, and you know what? You're in to see the doctor for a reason. Stand your ground and demand that you be taken care of. And I don't know about you, but my thing is, if one doctor don't work, I'll find another one that will, because I want someone that's going to advocate for me, someone that's going to work with me, someone that understands that I love life just as much as they do. And we have too much to lose if we don't do that. So never feel threatened by a physician, a nurse practitioner, or somebody that's telling you, oh, I don't think you need it. Listen, it's your life. And that is really, really important. We have a question from one of the viewers. They have a family member with COVID right now. She contact her provider and ask about the infusion. So the thing is, Key, I'm just going to ask you to again underscore what that window is if someone has tested positive, so we make sure we're giving them correct information.
Right. So it is 10 days from the onset of symptoms. So keep in mind that a lot of people, at first, when we're not feeling well, we think, oh, maybe it's just a cold. So we're already losing a few days. So it is 10 days from the onset of symptoms. So when you get that test result, you have to move fast. Now that you know that it's COVID, I mean, we get a lot of calls from people and they're on day 7 when they get their test result. And while we're not open on the weekend, there may be some place where you can receive the treatment on the weekend, but again, you're going to have to look into that. That's why it's critical that you act as soon as you get the results. And when you call that office, you have to stress to them, this is urgent. This could be a matter of life and death. I can't remember if Dr. Tuxen mentioned it, but in clinical trials, it has been shown that this drug has reduced disease progression and hospitalization by 70%. Just think about that for a minute. Think about all the lives that were lost and whether they were not offered this treatment. And I do want to share something else that was very disturbing to me when I first started looking into this treatment.
Okay.
One of the reasons we were so gung-ho to get it here in East Oakland, where we know that we have been inequitably devastated by this virus, is because we were reading studies that showed in the state of Massachusetts is where the study was that we were focused on. We could see where the drug was coming in to all communities, but 88% of the recipients were not people of color. So think about that for a minute. You know that Black and brown people have been devastated by the disease, have highest case rates, highest death rates. But then here comes this treatment, and these individuals do not have access to this medication. And that's what you have to say when you call the doctor. This is when I started my symptoms. This is when I got my test results. I am in the window. I need you to act now. And in most facilities, it's very easy to make the referral. our referral process is right online. You don't even have to call us. Doctor can go online, make the referral, and then as soon as that referral comes in, we're going to call you and get you scheduled for the treatment.
Yeah. Oh, I love that. I love that. Look, guys, don't go anywhere. We've got to just take another break. But when we come back, we're just not only going to talk about, I want you to, again, Keith, talk about how people can find the different infusion centers, but also I really want to tap into the fact that you talk about, you know, non-black and brown brothers and sisters is out there, but those were not initially the patients types that you're actually seeing in the clinic. So we've got to change that narrative. We've got to change it, and it starts with each one of you that's online right now, that you are listening and tuned into this. But you guys don't go anywhere. We'll be right back.
I work out every day. COVID won't kill me.
I'm 24. COVID won't kill me.
I have antibodies. COVID won't kill me.
It's been a long week. COVID won't kill me.
I'm 25. COVID won't kill me.
I'm partying outside. COVID won't kill
I
me.
don't need to wear a mask around my friends. COVID won't kill me.
I'm 23. COVID won't kill me.
If I haven't gotten it yet, COVID won't kill me.
I'm young. COVID won't kill me.
Famous last words. Don't let them be yours. Socially distance. Mask up, America.
Myth. If you get COVID-19, you'll recover after a few days. That myth is false. We're only just beginning to understand the effects of COVID-19 on the human body, as we're starting to see more and more people identifying as long haulers who are having symptoms for weeks, if not months, after their initial infection. Continue to wear a mask, socially distance, and wash your hands. Together, we can keep COVID out of school.
For ways to keep your community safe, go to backtoschooltogether.com.
All right. If you guys are just tuning in, listen, I want to remind all of you, you can save the link and you can go back and look at the show over and over. Please like it, share it, but really, really just, just ingest all of this information that you're getting from my guest, the director of Total Infusion Center, Ms. Key Conti. Before we went to break, Key, one of the things that I said, I really wanted to go back to the fact, because for me, it was eye-opening that you had people who lived in other states, but they knew that their children or loved ones lived here. And they were calling up to get treatment, and here you are, in the heart of East Oakland, where we know all around us that COVID is raging, and here's the treatment that's available for patients, and they're not being referred to the center. I'm shocked. I mean, I really shocked. Would you say so? Was you?
When we got the drug, I thought people were going to be beating down the door.
Right. Let me have that drug.
And it was not happening. We were not getting referrals.
Mm-hmm.
And when we started getting referrals, they were coming from surrounding counties.
Mm-hmm.
Now, if we have the medication and someone needs the medication, we are going to administer it.
Mm-hmm.
But one of the things that you have to do when you receive this medication from HHS is you have to report weekly how many doses you're administering. So this really skews the data when HHS is looking at our zip code, which is 94605, and the surrounding zip codes, and they're looking at the case rates, and they're determining how much region code they need to send into our infusion center. And then the only thing that I'm able to do on a weekly basis is to report how many doses we administered. I don't get to report who we administered them to. They just collect the number. So then it starts to look as though we are having impact on our community and we are administering this drug to the people that live in the community, but we're not, because people are coming from surrounding communities, and the people that live right here are not coming in. Now, thankfully, we have some partners in the community, and if this doesn't warm your heart, I don't know what will.
Okay.
For those of you that live here, Roots Community Health Center, they have a street medicine team. They are out on the street and they are testing people who are experiencing homelessness. If they find them to be COVID positive, they send them over to Operation Comfort, which is a hotel where they can have isolation housing for the time period that they need to be in quarantine. And then they call me and they bring that patient over here and we give them the treatment. And then they go back to Operation Comfort. And this is just amazing that this health center that's actually across the street from us, they are out on the street finding people in our community that are homeless and getting them tested, housed, and then sent here for treatment. So we do have some amazing partners now that are showing up. But initially, and even still now, the people that we are seeing, as I said before, we have pretty much 3 referral services. That's La Clinica, Roots, and the Watson Wellness Center. And just yesterday, we started receiving referrals from Lifelong Medical. But anything outside of that, when people have to find us, or the people that I talk to on the telephone that will not accept no for an answer, those are people outside of this community driving 2 and 3 hours to get here to get this treatment. And I get a lot of calls. My doctor won't give me the order. I'm going somewhere else because they're not having it. And we need to take that position as well.
Absolutely. Absolutely. It's ownership, and I'm happy to see that there's starting to be an uptake. But in an area and in a community here, when you think about Northern California, there is no excuse. And I'm just going to say, for any of you that are online that live in this area, definitely, lock and load on this information. So we've got some other comments. So let's see. Awesome information, so helpful. Having had COVID-19 before, that's great. Yeah, all right. Thank you, Ms. Deborah. Encouraging everyone to share this information. And Key, thanks for highlighting this information. She says prior to the show, she had never heard of it. So, and this is really important because, as I said, you didn't get the memo. We're all over the world. So here's the thing. Those of you that are in communities, Arkansas, Louisiana, Mississippi, Alabama, listen, no excuse. No excuse. You either have to get busy living or you just get busy dying. And that sounds pretty morbid, but that is the reality. Because if you are not advocating and pushing and demanding, for this, and a lot of times physicians don't want to tell you what they don't know. They, we understand they're busy, but you have a responsibility to say, here's the information I have printed off, make them go on to the internet, look up this information and gather it, and to get you treated, get you healthy, get you back out there into a lifestyle that's, I feel that you need, that if we don't do it, guess what? And so we have a question. If you can mention the brand name of the drug.
Absolutely. The brand name of the drug is Regen-Cove. So it's REGEN-COV, and the manufacturer is Regeneron. Now, what I will tell you is be careful not to go into the doctor's office, because I do realize that this is being broadcast all over the place.
Mm-hmm.
The drug that is sent to different states, it may vary because of the penetration of variants. So what you want to ask for, or what you want to say, is that there are monoclonal antibodies under emergency use authorization, because the drug in one state may not be the same. As an example, when we first went to order this, they were sending out bamlanivimab and etesevimab. However, they found that those drugs weren't as effective against the Delta variant. So they stopped sending them to California because the percentage of Delta variant was too high. And then they said that in the state of California, they're only going to send out the casirivimab and imdevimab. So that's why I just want to be careful about you going and asking specifically for the drug. Just say monoclonal antibody for COVID emergency use authorization. And you can also look up online to see what is recommended in the state that you're in.
Okay, thank you so much, Key, for for explaining that. We're going to take like a quick break. We're going to come back, and when we do, Key, we've got a couple other comments and questions, but I want you to address what keeps you up at night. What keeps you up, and what do you want people who are watching the show today to take away? So you guys don't go anywhere. Keep the questions coming. We thank you and we love you for that. We'll be right back.
Thank you for watching the You Didn't Get the Memo show with your inspirational host, Gloria Bailey Ray. It's your contributions that make this happen. To become a sponsor, send an email to youdidn'tgetthememo@gmail. That's the letter U, didn't get the memo. If you're not in a space to be a sponsor, but you like what you hear, we simply ask that you support what you like by making a contribution to the show. There are 3 ways to make an online donation. Visit paypal.me/Gloria Bailey Ray or Cash App or Venmo, Gloria Bailey Ray. Give what you can. Your support is appreciated.
All right. So again, if you're just tuning in, remember you can go back and you can watch the entire show. It stays up on Facebook as well as YouTube. But we've been talking with my guest, the awesome, dynamic Miss Key Conti, and we've had a number of questions. And although we've said that the drug essentially is free, we did have one of the viewers ask, to kind of give them an idea of what the drug would cost. And I don't know if you get involved in that or not, but are you able to respond to that, Key?
I don't know what the cost of this monoclonal antibody is, but monoclonal antibodies in general are extremely expensive because it's being sent to us at no cost. When it goes out on the invoice, it goes out at 1 cent. And that's just so that we can keep record of it, but I don't know exactly how much it costs.
Okay. All right. Well, and that's fair. I just want to share a couple of other comments, and I want to thank you guys. Texas is in the house. We've got Georgia in the house. We've got several different Texas. Thank you guys for being there. But the question was, what's the website that provides the map for monoclonal antibody access?
Mm-hmm. You can go on to Combat COVID, just Google Combat COVID. Mm-hmm. And actually in the bottom right corner, there's a pink bar. It says Mob Locator. If you click that pink bar, it actually takes you through a series of questions so that you can just kind of do a quick assessment yourself to see if you're eligible. So it'll ask you your height and your weight and if you have any chronic conditions. And then once it tells you, yes, sounds like you're eligible, it'll ask you to enter your zip code, and then it will show you the 5 or 6 closest locations that have the drug that are closest to you.
Right. Awesome. All right. So we just, I think that this is also important. People take the time to make a comment. They appreciate the information. People, thank you, DACPA, that says post it on their social media sites. And we've got that one. Let's see. We have another. Can you talk about the cost of the treatment for those with and without insurance? So that keeps kind of coming back up, but your
absolutely,
thoughts?
Absolutely. Mm-hmm. So for patients that have Medicare, Medicaid, or are uninsured, there is absolutely no cost. There is no copay. There is no cost sharing. For individuals that have commercial insurance, most of those insurance plans are paying the administration fee. However, everyone has different types of plans, so you would need to check with your insurance plan. What I can tell you is this. Most facilities, if you are not well even here, if you are not well, we're not going to haggle over $500, which is what the administration fee is, $500 or $600. We're not going to haggle over that because your life's not worth it. So we're going to make sure that you get treated. Many insurance companies will say that you need to go someplace in network. Well, sometimes that's challenging because in network may not have an appointment for you for 2 weeks. So you're not going to wait 2 weeks. You go to the closest infusion center that says that they can see you and they can administer that drug, and then fight with the insurance company later about that administration fee.
Right. I agree with you. I used to always say you can't squeeze blood from a turnip. So get the treatment and worry about that later. But at the same time, get out there and ask questions, get information. In fact, thank you, Miss Georgia. Wants to know how they continue to help spread the word, and we will be calling on you. We appreciate that. And also, Facebook, Snapchat. I love it. Definitely. Thousands of friends and followers, because there is no reason, that people aren't aware. And like I said, for me personally, I always say you can't give me back my family member. And for me, with one of my family members that tested positive, they were able to get the treatment, I think, over at Emory, and everything has been great. So I just really, really stress to you guys why I do this show, providing you with that relevant, factual, mainstream information to help you be informed and to make informed decisions. That's really and truly what's it about. I said to you, Miss Key, what do you want people to take away from today's show? Thoughts?
Most importantly, I want people to realize that those out there that think that, oh, I had COVID and it wasn't a big deal, please know that we are still learning about the after effects of COVID. We know that individuals are experiencing long-term adverse health effects that involves their heart, their lungs, and their brain. So as Dr. Abalada always says, we are not playing around with COVID. If you are positive, get treatment. We get calls from families who have loved ones in ICU. I can tell you personally that here in our infusion center, we've received orders for a husband and a wife. The husband comes, the wife doesn't, and we have cases where husband is now at home, wife is in the hospital. And I just want to thank all of you for all of the messages and the feedback that we're seeing. And please do share this information. I consider this my protest. Okay, this is how I take a knee. This is how I run with Maud. This is how I say her name. This is my protest. And I am so grateful to all of you for protesting with me. If organizations and counties and public health officials are not going to share this information, then we have to do what we're doing right now. We have to share this information with one another. And I'm not so hot on the social media, but I know all of you are. So help us get this information out there so that we can see impact in our community and stop losing life and ending up with these long-term effects from this COVID.
Yeah, absolutely. Well, I want to, first of all, thank my guest, Ms. Key Conti, for being on. I have been throughout, you see her contact information, and reach out if you have questions. They have a beautiful, beautiful infusion center, and you will be in great hands. So, Ms. Key, don't you go anywhere. I'll be right back. I want to also give a gentle reminder to all of you just to remember to support our efforts. It really and truly is about providing you this type of information. 8 years in the running, and I'm totally grateful to all of you who have become supporters and who are supporting and getting the word out and sharing the information. I thank you from the bottom of my heart. So I want to continue to bring this program to you, and let's just be a blessing to other people. I want to just ask, are there any parents out there, any grandparents? Do you want your children to aspire to be a part of the STEM program or STEAM program? Do you really want them to succeed? Listen, Well, you will not want to miss next week's show, where my guest will be physicist Dr. Dorian Bowler. And he is the author of a book called Physics and Basketball. Great read. This young man is so dynamic. And we're going to talk about, you probably said physics and basketball. Listen, there really is a message to it. I also want to say to all of you, I got something for you. Follow me on all my social media platforms. But listen, in order for you to get a free You Didn't Get the Memo t-shirt, here's what I need you to do. Let's see if you guys are paying attention. You need to send an email to you, the letter U, didn't get the memo, at gmail.com. With this information in the subject line, I need you to write, I love You Didn't Get the Memo show. That's right. I love You Didn't Get the Memo show. Be sure and include in the body your mailing address, and the first 3 people that sends me an email with this information will receive a You Didn't Get the Memo t-shirt. Tell me your size, by the way. I need to know that. All right. And I want to give a quick shout out to all my new viewers, donors, sponsors. Thank you guys so much for tuning in. And I love it. You guys are still sharing the information, and I love that. Thank you guys so much for that. But until this time, next week, I always say this: if you didn't take anything away from today's show, then it's really you who didn't get the memo. So have a great week. Give thanks for all of your blessings. Stay safe, mask up, practice self-care, be kind, and I don't care what you do, always, always, always pay it forward. Guys, be well. God bless you. I'm your host, Gloria Bailey Ray, and you have been tuned in to You Didn't Get the Memo. Peace out.